All right, welcome to Beyond Scrubs, Dr. Ismael Mohiuddin. I'm glad to have you on this episode. Can you introduce yourself?
Sure. My name's Ismail. A Houstonian by trade. Went to school with Daniel at Texas Tech in Lubbock. We're roommates together for quite a bit of time, and now I'm a PGY1 in neurosurgery at Houston Methodist. Yeah, living the dream.
Yeah, awesome, awesome. Hopefully, I pronounced your last name correct there as best as I could. But talk to me, kind of what inspired you to go to medical school and the route that you took to get into medical school.
Yeah, sure. What inspired me to go to medical school? I think, like many Asian Americans, there's a family pressure and desire to want their children to go to medical school. I was not in my immediate family, but in my extended family, surrounded by doctors, and I saw, they had a great amount of respect and admiration for the profession and helping people. I think that very much drew me to it initially, but that's not enough. You have to actually go and see for yourself whether or not you see yourself fitting into these things. And so throughout undergrad and even in before undergrad, I was pretty interested in trying to figure out if this might be something that I want to do. Um, and like many people, I was inspired by, people in the public sphere that were physicians that you admired and wanted to be like. And so I think, the three things that probably drew me to it were, family pressure and wanting, my parents wanted me to do that. And that was a small component of it. But then seeing physicians I knew, even in my extended family, living good lives, having respect and admiration for their profession, and really being dedicated towards it, and then being inspired by people outside of my own family and being drawn to their experiences as well. And then, of course, you go see for it yourself, and there's nothing like being a doctor. So those are the things that really drew me at a young age towards being a doctor. And then my track towards medical school was a little bit non-traditional. It was non-traditional. In undergrad, I wasn't the strongest student. I did well when I had to, but that sustained excellence that's required to get into medical school, I didn't really have. But I tended to do well on standardized tests and that sort of thing. So coming out of undergrad, I knew I wasn't going to be a strong applicant, so I didn't even apply as an undergrad. I went and did my master's program for a year and a half. And after my master's, I applied for a spot in medical school, and I got it in a couple of places, but they weren't actually institutions that I really wanted to go to. I didn't feel comfortable there during my interviews, and so I ended up at that point. The last thing I could do, I did. I finished undergrad. I took the MCAT once. I did fine, and then I went through a master's, and I did fine. So I thought I would just retake the MCAT, throw my hat back in the ring one more time. So that's what I did. I took the MCAT. After finishing my master's, I did pretty well on it, and that I think opened up a lot of doors for me. And then I ended up getting into Texas Tech. And once I knew I was in the MD PhD program, there was no other place I wanted to be. It was a very easy decision. So yeah,
Sure. Yeah, awesome route. Took a little bit time to get there, of course, but definitely for sure, got a lot of degrees on the way.
yeah,
Talk to me
exactly.
kind of, yeah. So talk to me about the double doctor degree, right? The MD, the PhD. So what was your reasoning behind this, and how are you going to use both degrees in your career, you think?
Yeah, absolutely. The reasoning behind it, I think, and even in undergrad, I really found myself doing well in the lab portions of all of my courses, whereas maybe the didactic portion was where I struggled, but really putting things into practice and like actually doing experiments and learning that way was genuinely rewarding for me. So I always had a tendency towards lab work and bench work. And I always wanted to be, thinking back to talking about how one got into medicine, the people that I looked up to the most were on the cutting edge of medicine, always trying to innovate. And so that was something I wanted to do myself. And so I was always drawn to research in that way. And then thinking about problems in medicine that really mattered to me, I was, like many people, affected by cancer in my family. And so I knew I wanted to work on something that had a real significant impact. And so cancer is one of those things. And so I think I just naturally gravitated towards trying to be in that position, and luckily was able to get in. And then with respect to using it in my career, that's a good question that I think I change the answer to every time I think about it.
Sure.
Coming into residency, I thought I'd be a tumor neurosurgeon, and that would be what I was going to do. And but now I realize that there's a lot of different ways that you can leverage your research background, the skills one learns in the lab, whether it's as a PhD or just working in a lab. Those are very easily translatable to a lot of different areas of medicine. And so I haven't yet fully decided. I know I want to be involved in research.
Yeah.
I think my natural inclination is to go towards cancer, but I think I'm pretty open to doing a lot of things. So
Sure. Sure. Yeah, definitely. Not many people have your track record. Of course, there's been MD PhDs in the past, but of course, finding that perfect balance of being a clinician and a researcher is definitely a difficult one. So, of course, that'll probably evolve as you get into residency, kind of
yeah.
figure out what you want to do, of course. But I'm just curious. Talk to me about what was your thesis on, and what was the title, so that people listening to this podcast can kind of tune in and see kind of what you wrote.
Yeah, sure. So my project was on small cell lung cancer, and my lab was a neuro or is a neuroblastoma focused lab. We found a mechanism of activation of one of the classic oncogenes that many people know, or if you know the Yamanaka factors of stem cells, one of those is the MYC oncogene. And so my lab found a new pathway of activation of the MYC oncogene in neuroblastoma, but then um, my project, and actually the project we worked on together when we first met, was trying to figure out what other types of cancers does this pathway exist in. And so we found that small cell lung cancer, which is a very um, devastating disease, and
Yeah.
the life expectancy is not great once diagnosed. Super aggressive disease, very treatment resistant. So my project was to try to figure out if we could target this pathway in small cell lung cancer and make any discernible difference in treatment. And so I found a compound. The title of my dissertation was narsiclastine, which is a drug. It inhibits DNA PK mediated phosphorylation of OCT4, which is a driver of c-MYC activity in small cell lung cancer. So that was sort of the basis of my project, was targeting this pathway where DNA PK, which is a kinase, activates another Yamanaka factor, another transcription factor, OX4, which then drives c-MYC activation in this type of cancer. And if we could target this pathway and prevent c-MYC activation, could we potentially treat small cell lung cancer? And so, uh, in in terms of clinical benefit, it's tough to say if there would be any discernible impact, but nonetheless, we found that the pathway is activated in small cell lung cancer. We found a medication or a drug that actually inhibits the pathway, and it does extend, at least in our in vivo models, extended survival.
Awesome.
So in that sense, it was beneficial. But any PhD will tell you, once you take it from, you can do the most perfect in vivo experiment, you can have all the in vitro data you want, but to bring it to fruition in clinic is uh, it's a different beast altogether. So we'll see. But at least in terms of our experiments, we found a notable benefit.
Well, awesome, awesome. Very high level, complex stuff. I hardly followed you there, but awesome stuff. Brings me back all the way to kind of a little bit of step one studying there with the MYC oncogene and
Absolutely.
things like that. But definitely for sure, very groundbreaking stuff, which is definitely something that I can see you kind of doing in the future. Especially now that you were able to kind of connect that small cell with also neuroblastoma, so you kind of set kind of where you are today. But talk to me, what is harder, medical school or the PhD route? If you were to say, 4 years of medical school or your PhD route, which was more strenuous, you think?
Yeah, that's a good question. I think I would. They're different. I think the PhD part's probably harder,
Yeah.
um, in that there's not a real road guide. There's not a roadmap or a guide, or there's no like exact formula to be successful in the way that there is maybe in medical school. A PhD is very much you get dropped in, and here's a problem, and please figure out a solution as best you can. So it requires a lot of creativity, a lot of your own research and trying to figure out what you think could work, and a lot of trial and error. in a way that medical school is more, here's all the information you need to know. These are the ways you can learn it. And it's just your job is to just, put your head down and try to grind as much as you can to learn all that material as best you can. But there are ways people have been very successful with a number of different strategies. But, if you follow people that have done it before and have done it successfully, chances are you'd also be successful. Whereas a PhD is a little bit different. I don't think there's that clear cut sort of
Yeah.
route towards being successful. That being said, I mean, medical school is very, very difficult for me, very, very challenging for me. It required I needed a lot of help to get to where I wanted to be. And so in that sense, it's medical school is no joke either. So,
Sure.
yeah, different, but I would say the PhD is slightly harder just because the amount of, you know, trial and error it takes to be successful.
Yeah.
But nonetheless, the medical school is, everyone knows, super
Yeah.
hard. So,
Yeah, for sure. For sure. Yeah. I mean, you've lived with me and we've talked about this a little bit before, but yeah, PhD, like you said, there's not a really direct route. Medical school, yeah, it is difficult, of course, and you do need help along the way, but at least the path is pretty apparent and clear. So it's difficult and you understand that's difficult, but at least you're like, oh, if I do these things, but it seems like a PhD, when I talk to you about it, it's kind of a little scrambling a lot of times and,
yeah.
figuring out, it's kind of like a blank canvas is when I talk to you about it. It's kind of just like you said, they give you something and you kind of have to figure it out yourself. So
Yeah, and the amount of luck required in a PhD to be successful, I mean, no, you can't discount that. I think
yeah,
medical school, there's not a whole lot of luck involved. It's really like, if you do the work, you are successful. Whereas a PhD, you can do all the right things, do all the right experiments, and things just don't work out for whatever reason. So there's a component of luck involved too that you have to be very fortunate to get. So.
for sure, for sure. So now still kind of talking on the PhD topic here. If you were to list one major valuable lesson you got from the PhD route, what kind of would that be?
I think this translates really well into residency, but it's, persistence and resilience. Those are things that you need as a PhD where, again, you're doing all the right things, you're doing all the right experiments, your technique is good, you feel really good about the result, like what you're going to get, and you get something that doesn't make any sense at all. And it requires either repeating the experiment, troubleshooting, or just completely changing your opinion on what you thought was going on. Um, and that's a constant process over and over again. And I was very fortunate in my PhD time to have great mentors who were able to kind of coach me through those moments and help me redirect what I was thinking and give me new perspective and even help me troubleshoot all my experiments. That translates really well into medicine where you need that amount of resilience and persistence. You have to, the residency, at least in my short time in it, has been very challenging and requires a person to really kind of push forward when things don't make a whole ton of sense or you're not working with the amount of knowledge or comfort you want. I mean, residency is a lesson in being uncomfortable over and over and over again, where you're put in situations where you have great mentors and people, senior residents, attendings who are there to help if needed. But oftentimes, you're having to figure things out for yourself and learn on your own and that sort of thing. And so I think a PhD, that's a great lesson I got from there. And I think I have a higher tolerance for that than maybe the average person does just from going through that.
For sure, for sure. Great kind of lesson there for sure. Talk to me kind of advice about handling stress in medical school or, someone doing a PhD.
Yeah, I think it's very easy to say now, very hard to believe when you're in it. And I even struggle with this as a resident, but you need to take time for yourself and be a human outside of whatever you're going through. Whether that's being a resident, I try to carve out time every week for myself and do things that make me um, feel good about just being a normal person, not just, constantly worrying about medicine. And then similarly, as a medical student, as a PhD student, it's so easy just to get caught up in whatever you're doing. And sometimes you just have to put things down, set things aside and go do something else and try and unwind and relax that way. And even with, when you think about trying to be creative and trying to come up with a new idea, a new solution, so like in a PhD, for example, those things can be very helpful. I mean, there's a great amount of research and literature and people have written tons of books and self-help, novels or whatever about, the idea of setting your problem aside and going and doing something else, and that actually triggers something in your mind that makes you more inclined towards solving whatever you were worrying about initially anyway. So I would say that find whatever your hobbies are, go stick with them. There's no amount of you're not going to do better in medical school because you studied for an hour and a half more per week than, over the course of 4 years or in your PhD, that you're not going to come up with some amazing discovery in that hour and a half. But, if that means you can go work out or go for a walk or play some music or whatever it is that you do, those things will benefit way more than just trying to slave through whatever you're working on.
For sure, for sure. That recharge button is super, super important. And, stress is so prevalent with our career path. So it's definitely, I always ask this question for anyone who's on the podcast because having different modes of getting that stress out, resetting to get back on, back and recharge is so important in our field because you're going to get burnt out really freaking fast. So.
Absolutely. Absolutely.
So March, in March, right, we just had match. So, I just want to hear what's your general perspective on, the match process, how was your match and your experience with the match process?
Yeah, match is, a crazy time in the life of people. It's kind of, you tell people not in medicine that your success or not success, but where you end up in medicine is all sort of determined by, a week-long stretch of, did you match and then finding out where you matched. And it's a grueling amount of, work that's put into just this like finite moment of whether or not, in many people's eyes, you're successful or not. And so for me personally, I also got married in match week, which was a stress in and of itself.
Yeah,
And looking back, would I do it again? I don't know, but it was a memorable time in my life for sure. And yeah, I think so much can be said about whether or not you're successful in match and people have, you have your top choices, you have, if you dual applied what you wanted to go into versus not. I think things tend to just work themselves out. And it's very easy for me to say that now because I ended up where I wanted to be. But nonetheless, like I think whatever happens, you can kind of carve out your own lane and be successful in that way. I think the match is a very grueling and at times unfair. It seems unfair in many ways that you put in all this work and you really it's kind of out of your hands, and you're so dependent on this algorithm and these micro interactions that you have with people throughout your time to kind of determine how your career is going to be shaped. But nonetheless, I think anyone, despite if you match, if you don't match, if you match into your top choice or your 15th choice, or if you matched into your specialty that you wanted to go into or your backup, you can find a way to still be successful in your career and kind of end up where you want to go. There's, as we talked about before many times, there's many routes to get to where you want to get to, including getting into medical school. But even as a resident, as a physician, if you want to be, practicing in a certain sphere, there's many ways of getting there. As you get more and more specialized, the routes to get there can be a little bit different. And so we've talked about, you can be a skull-based surgeon in a number of different ways. You can be an interventional neuroradiologist. You can go through that in a number of different routes. There's different ways to get to wherever you want to go. And so, if you're passionate enough and you really figure things out, like what matters to you, you can find a way to get there. So anyone
sure.
listening that has just matched or hasn't matched or is preparing for the match, just know that there's many great people don't match. Many great people don't match in their top choice or in their desired specialty, but there's a way to get to where you want to go. And not matching is not a failure on your part. It's just another part of your story.
Yeah.
So
Yeah. I think that's super important. And, I'm glad that you mentioned that. So talk to me about, what advice would you have for, let's say, how match week works, right? First Monday is when you figure out you get into your specialty or not, right? So what advice do you have for, you open that, you get an email on Monday saying you didn't match into your specialty. Now you have to go through. So talk to me kind of, what advice do you have for a medical student undergoing something like that?
yeah, my biggest thing at any point of reaching a point in medicine where you don't get what you want is to reach out to people who are higher in station, have a little bit more experience, mentors, whatever you want to call them, and kind of get their advice, seek out their advice on how can I best proceed. Anyone in medicine will have had some attending, some resident, someone that kind of took them under their wing at some point. Even if it's, in your dean of student affairs type situation, if it's someone you rotated with, whatever it is. I think most people in medicine are very open to helping medical students, especially those that they feel are accomplished and can be great physicians. They'll be very invested in you. So I would highly recommend, you know, for a person who got to that point and realized they didn't match or whatever the case is, whatever point you're having trouble with in medicine, is just to reach out to people who have kind of been through something before or even have just a different perspective and kind of get their advice on. I actually just talked to somebody who didn't match into neurosurgery, and they gave me a call and asked me, what they should do. And the question is, there's so many different questions to ask, but one of which is, what do you want to do as a student? Do you want to continue pursuing this path, or do you want to go towards other paths? And those are, trying to figure that out and trying to talk to somebody who's more senior than you about that kind of gives you a perspective. So that would be my number one bit of advice would be reach out to people, residents, attendings, whoever, that have just kind of gone through more of the process than you have at this point, whether or not they even soaked or not, whatever. But
Sure.
if they've seen things, and so kind of get their perspective and go from there.
Yeah.
And it's easier to say, but just take a deep breath because it'll be fine. Whatever happens, it'll be fine. So
Yeah, for sure. And people, every cycle reach out to me kind of talking about, what happens if they didn't match ENT? What do they do? Right. And kind of very similar advice that you're saying is, for one, you got to reach out, right? Asking for help. I think, especially in medicine, because of the personalities that, that are attracted into the medical field, I think we have an issue with asking for help. But I always see it as a strength, not a weakness. If you ask for help, it's kind of like a shortcut, right? You're trying to get people's perspective that's already gone through something, and they kind of help you pave that path. So asking for help is not a sign of weakness. We just have issues asking for help, especially in medicine. But such a great piece of advice. You're gonna hit bumps in medicine, right? Whether it's from pre-med to medical school, whether it's from medical school to residency, whether it's from residency to being attending, right? And so bumps are gonna happen, but that kind of makes you who you are for sure. And along those ways, I mean, I'm a big proponent of asking for help, right? And that's gonna, that's where you're gonna get the most valuable information for sure.
yeah, absolutely. I think we've talked about it before. I mean, LeBron James needs a coach,
Yeah,
Roger Federer and Novak Djokovic need coaches.
yeah,
Like there's no harm in asking for help and getting people's perspective. You can be the greatest at what you do, and you just need someone else's opinion and perspective and, you know, their help in kind of fine tuning what you're maybe missing out on. We all have blind spots, and like you said, you might have a hiccup getting into medical school, you might have a hiccup within medical school, getting into residency or becoming an attending, you might have a hiccup in all of those things and hit a block at all those points. And that just makes you, that builds that resilience that we were talking about before. It builds your perspective, and then that gives you the ability to reflect when someone else needs your help and say, hey, I went through that myself. And
yeah,
so, we all know what problems we go through to get to where we are, but to the outsider, many people will look at you as a medical student, as a resident, as an attending, and say, I want to be exactly like that person, not knowing what it took to get there, not knowing that, you went through your own battles to get to where you are. And so, yeah, I think asking for help is, again, it's not a sign of weakness, it's a sign of strength, actually. It's having humility to know that I have blind spots and that I can get better. So,
for sure. For sure. Great. I mean, exactly. Right. And, that's one of the reasons why, I wanted to do this podcast is that, a lot of times during the medical career, for me at least, I can say that you sometimes feel as though when you have these blocks, you're thinking to yourself like, oh, I'm the only one that's like struggling. Right. Because even you're kind of, so focused on you, and and then when you look outside, you think everyone's like having this like nice path, of like, oh yeah, they're doing this, they're having so much more research than me, they're getting better scores than me, they're easily matching. But yeah, everyone has their own battles, and I think we forget that as we're all human, we all have our own battles, and a lot of the times you only see the end result, right? And so no one knows on the outside kind of that everyone has their own battles. We just, a lot of times you don't realize it. So for
Yeah,
sure.
absolutely.
So talk to me, if you didn't match into your specialty, if you were to give advice now, knowing kind of what you know, where you are now, right, and you don't match into your competitive specialty or whatever specialty that you go into, would you recommend a research year or prelim year? What would you say?
It depends on what you're trying to do. I think research years can be incredibly beneficial in that if that's what's lacking in your application, which for I think a lot of people it is, then it's a great route towards getting publications and being able to, get your foot in the door and beef up a part of your application that you can't, that you can still change. So what I've told people that I've talked to is, your step one score, I guess step one's pass fail now, but even still, your step one score is your step one score. You can't change that. Your step two score is your step two score. You can't change that. Your clerkship grades and evaluations, you really can't change those things either. And at this point, right, they're all set in stone. All your other grades and stuff, and all your activities in medical school, you really can't change. What you can change is sort of, if you're getting new letters of recommendation, and working with people in your desired field and your research, those are things that even after medical school can be changed. So if you make a really good impression and do a rotation while you're doing a research year, and you get in the OR with people, and you have someone go to bat for you that has some influence and say, hey, this person's actually amazing. That's something you can change. If you can put out, a number of publications in your research year, that will absolutely change your application. The big risk with those things is not doing the big risk with taking on a research year is not being productive, not getting good letters of recommendation, not making a good impact wherever you are. I think it's a high risk type of route to take a research year, because I think it's a very self motivated type of situation. You have to seek out research projects. You have to be the one driving the research
Yeah,
projects. Typically, you're going to be working with residents who are swamped with a million other things, or attendings who, again, also don't really necessarily have the time to work on whatever they're working on, or whatever they're having you work on. And so it requires a dedication and a persistence and a really a significant amount of motivation to be productive in those years. On top of that, also making a really big impact at the program that you're at. Because I really do think if you take a research year, the best chance you have of matching is likely at that institution versus other institutions that you interviewed at before or you're familiar with before. Um, Unless you put out a nature
sure,
paper in your year, whatever, right?
sure,
If you do
sure,
something amazing.
sure.
Um, but yeah, so I think a research year is a great opportunity to beef up parts of your application that you can
Yeah,
still change. Um, that maybe not is afforded to you as a prelim year, but what a prelim year maybe gives you is a different perspective on whether or not you actually even wanted to do what you thought you would,
sure.
versus would you just be happy doing X, Y,
Yeah,
and Z. So, for example, for the situation of a neurosurgery applicant who didn't match, and they already have pretty good research, and they're saying, I think I should probably do a prelim year. Maybe you fall in love with general surgery, and you said, you know what, I just want to be in an OR, and I don't really care what type of surgery I do. I'm happy just to be operating. And so, if that's the case for you, then maybe you do really well in your prelim year, and you go match at that program. And so, I think that can also be very beneficial. So what I would say for, research year versus a prelim year is to self-reflect on your own application and look at the number of research publications that you have. Are they high quality ones? Are they ones that are within the field of whatever you're applying to? So for me, is it a neurosurgical publication or not?
yeah, yeah,
People can have, 500 case reports and none of them have anything to do with what you're applying for. And you wonder, is that even going to be that beneficial?
yeah,
Um, if the answer to that is no, then I think seeking out a research position is a good idea, and it will help you get your foot in the door at whatever program you're at. But if you do have those things covered, then, a prelim year is not a bad idea. I think it gives you something to do. You could potentially get your foot in the door with whatever, even if you're doing a surgical prelim year and you want to do ENT, there might be some overlap. You might be able to scrub into some ENT cases. you might be able to come in on the weekends and say, hey, can I take call with you guys or whatever.
Yeah.
You got to put in those extra hours and that extra work to get to where you want to go.
Yeah.
And people will see that and see that you're trying really hard still to get to where you want to be, and that will reflect well on you. So, I think it's very individual dependent, but both are decent options.
Sure, for sure. Awesome, awesome. Well, thanks for walking us through that, because I know, during this time, and especially the match time, right, people are going through a lot of emotions. Well, whether they matched, right, great emotions there, whether they didn't match, whether they had a soap, right. So definitely for sure, a tough time for a lot of medical students. And so getting that perspective of somebody that, got into neurosurgery and kind of went through that and also did an MD PhD and did all that stuff. And so definitely great perspective there. So talk to me now, we've talked about the PhD, we talked about medical school. Talk to me now, we're going to transition a little bit. How did you choose, neurosurgery as your specialty, right? What made you interested in
Yeah,
neurosurgery?
I think it's even as a child or growing up, I always had an interest in neuroanatomy, which I think is true for a lot of people. I always had an interest in the brain. I think the brain is such a fascinating organ. It's what makes us human. It's it is everything that means to be human, I think, is, encompassed within the brain. So there's that element of it too. And it's just a very cool thing to do every day. There's never a time still in my, even though I'm still just an intern and only a few months in at this point. Um, but anytime you take off the skull and you're seeing the brain, it's still the coolest thing I've ever seen. I don't think that'll ever get old for me. Similarly, doing a big spine operation and you're just seeing what you're looking at. And this is incredible that we get the opportunity to do this. I think that wonder was always around, and there was always a mystique around neurosurgery. Where we went to school, we didn't have a neurosurgery residency program, and so our exposure was a little bit different. But anytime I was able to, I remember, the story of really me cementing my desire to do neurosurgery was being on my general surgery rotation as a third year medical student. I was, that's somewhat late to decide fully that you want to do neurosurgery, but I was on the abdomen side of a VP shunt case, and all I could do is keep looking up at, like, what are they doing over there? And now being a resident, a VP shunt is something that we do multiple times a week. It's a very common neurosurgical procedure, but even as a medical student, I was in awe. They're using neuronavigation, they're going into the brain, they've made a incision that's not too big, and they've made a
Yeah.
burr hole and they're passing this catheter. What is going on? I was just fascinated. And so my general surgery attending was like watching me look up, and he said, hey, I think you're more interested in like what's going on up there. And he was very nice, and he's like, I think you should scrub out and scrub in and go see what they're doing up there. And so he introduced me to the neurosurgeon that we were working with, and that's kind of how I got in with our program, and our attendings that were at our institution, and trying to be more present in their procedures and learn more about it. And so, I was just in awe of, I've always been in awe of the brain, but then seeing the actual practice of neurosurgery, and even that one moment that really drew me to it. And then I just kind of pursued my interest and thought, is this for me or not? And so the more time I spent there, the more I realized this is what I want to do. And neurosurgery is a very privileged field in that you really take care of people at a very critical juncture in their health and in their life. I mean, for many people that you see on a daily basis, what you're doing and what you're talking about is the most significant thing that has happened to them in their life. It's something you see often every day, but for them, it's something that is, life changing, life altering. And even if it's something minor, to them, it seems like the most important thing, which oftentimes it is. And so to be in that privileged position is significant honor. And I think I always wanted to try and be that sort of doctor that was, patients could feel like heard them and they could be relied upon. And I take that privilege very seriously in my training. So those are kind of the components what drew me to it. Not to say that you can't find that in other specialties, but it's kind of the combination of all those things.
Yeah, for sure, for sure. And I think, when you're picking a specialty, right, whether it's neurosurgery, whether it's ENT, family, pediatrics, whatever specialty you end up choosing, right, you got to have that passion, right, for your specialty, for your field, right, and, passion is going to be the key because, your job should feel important, right? You should feel passionate about your job and kind of taking care of patients because that's what we're here to do as physicians. So definitely for sure, great perspective there. So talk to me
Yeah,
a
and I
little.
think
Yeah. Go ahead. Go ahead.
Oh, sorry. I think,
Yeah.
people oftentimes counsel against this, but I don't understand why. I think there's nothing wrong with finding a person whose career you want to emulate. So for me,
Yeah.
there was neurosurgeons that I saw that I was like, I would love to be like them
Yeah.
when I'm done with my training. And, I think that's an inspiring thing. It's like a target that you can set for yourself. Like, I want to be
Yeah.
more like that person. And then as you go through training, you realize you take little bits of everyone that you're surrounded with. And, in my program now, all the different mentors that I have, all the different attendings I work with, I'm going to be, when I'm done with training, some sort of amalgamation of all of them. Right? I'm going to take a little bit from every single one of them and become my own, hopefully become my own type of attending. And I think there's nothing wrong with that. I think you should
Yeah.
find people that you admire and respect and want to emulate, and if that's what drives you towards a career path, then fantastic. Like that's honestly, you've probably figured out more than most people have pretty quickly.
Yeah.
So yeah, I would recommend to any student trying to figure out what they want to do is look at people at your institution who you admire and respect and be like, do I want to do what they do on a daily basis? And if the answer is yes, then you might want to do what they do on a daily
Yeah.
basis. It's pretty simple. So
Yeah.
yeah.
No, for sure. I mean, I'm all for that. That's how I wanted to do ENT. I mean, I always thought, the anatomy of the head and neck, and we work in conjunction with you guys a lot of times too with our school-based stuff. But, my main thing, and I've told you this before, how I chose ENT is, one of my mentors from first year of medical school, I was like, oh man, shoot, I just like, that's what I want to be, right? Like that's who I want to emulate and kind of, model myself after, right? And that's just kind of sometimes those connections are enough to say, hey, this is exactly kind of why I want to dive deeper into figuring out is ENT what I want to do, and that happened to be kind of it for me. So yeah, for sure. I mean, a lot of times you are influenced by your mentors around you, and I always say some of the ways that people pick specialties is by their mentors and who they're surrounded by. So I don't think it's a bad thing to emulate anyone for sure because that is the
Absolutely.
goal. Yeah. So yeah, so talk to me a little bit about intern year, right? So now you're in intern year, right? We've gone through kind of the whole kind of gambit of how you got here. So now you're living it as an intern. Tell me kind of how that's like. Give me a summary of how that's like.
It's demanding.
Yeah.
I'm very lucky at my institution to be surrounded by very good people. Um, Senior resident, junior resident, senior residents, attendings who kind of have your back at all times, and allow you to learn and make the right type of mistakes. But intern year is nothing. There's no preparation for it in med school. Truly, I think it's just a different level of um, commitment and responsibility that we have not yet had as students. And so, you know, as a medical student, you write notes and you say like, oh, this is what we're supposed to do, and you kind of leave it at that. You write your note, you go about your day, and whatever. As a resident, you write your note and you have to follow through on that plan. This is what we're doing, and who is responsible for making that happen? That's you. Um, and then as a resident, I mean, even as a first year resident, you introduce yourself as I'm the neurosurgery intern, I'm the neurosurgery resident. Um, I'm in service today. I'll be taking care of you on behalf of Dr. So and so. Just having that doctor title by your name, I mean, it elevates your standing in the eyes of many people, whether it's, patients or, other staff at the hospital, whatever. So people start looking to you to knowing what to do, even within, a few months of training. You have to start being able to make some decisions. And of course, don't know what you're doing.
Yeah.
That's why you have senior residents. That's why you have junior residents. You have people you can call upon and say like, hey, I need help and I don't know exactly how to work this out, but nonetheless, you have to have the responsibility is just greater. And so there's that aspect of it and that adjustment to it of, I'm no longer just a medical student that's observing. I'm an active participant now in this person's care. And I'm not the only person involved, but I'm an active, significant participant. I need to advocate for my patients in a way that's different than when I was a medical student. And then there's the rigor of, the hours, which are just different. I don't think even as a sub-I think I worked a lot of hours, but as a resident, again, it's a
Yeah.
different stress. It's a different, even if you're working the same amount of hours, those hours feel a lot different. And then there's also the rigor of having to keep up with material and to continue to learn and study. And so, after a long day when you're very tired, and you've been on for, however many days at a time, or you just post call, you have to find the time to carve out a little bit of time to study and learn things and prep for the next day. Those are challenges that, I don't think medical school can prepare you for. It's not supposed to prepare you for. That's what intern year is for, is to learn those things. So it's an adjustment period for sure. At the same time, it's kind of what we're here to do. And,
Yeah.
there's many times we've been walking around the hospital late at night on a call shift and you're like returning a page where you're also just like, this is amazing that I get to do this,
Yeah.
like this is crazy that I'm doing this. So, and many times for me in the OR that I'm still in awe that like I get to be the one to do this part of this procedure. And so I try not to lose those things, and I hope I don't. I hope I still often like reflect on that and think how lucky I am to be here. So yeah,
For sure. For sure. Yeah. That's a great way to kind of, give your perspective on intern year. I had very similar experience too. It's kind of the awe factor, but also on top of that, steep learning curve, of course, right? Balancing kind of, getting new to systems, of course, figuring out how to take care of patients, figuring out your role, right? But one thing that as interns, me reflecting back, and kind of all interns probably that ever was an intern, right, can kind of relate. But you're going to make mistakes, right? So talk to me, like, how do you in particular minimize mistakes as best you can? Because when you're a first year resident, you're going to make mistakes, right? You're going to have those bumps in the road because you're still learning. That's why it's such a long route. So how do you minimize mistakes?
absolutely. I think you're gonna annoy some people, but it's important to just double check when you're not sure. And I think most people, attendings especially, will admire your desire to just, I'm trying to be extra careful. I'm looking out for, the patient here. It can be something as literally as dumb as, I don't know if this drug interacts with this drug, and it's Tylenol and something where it's probably benign and nothing's going on.
Sure.
But if you take the extra bit of time to call pharmacy and say, hey, I'm about to prescribe this drug to somebody, I just want to make sure, is this going to mess with something else? And if they say no, great, whatever. You saved yourself a lot of stress by just double checking. If you're worried about something that an attending said, to send them a message, shoot them a text, give them a call, say, hey, I know you already told me to do this, and I just want to clarify to make sure that I'm not doing something that I shouldn't be doing. This is what, can I clarify, whatever. Sometimes, people will be a little bit annoyed, and you obviously, of course, do that with your senior residents. And sometimes a little bit of a headache and annoyance, but most people will respect that you're trying to double check and you're looking out for the patient. You don't want to make a mistake. You can do all of those things and still make a mistake. 100% that can happen. It happens to every intern, every resident at some point. Something gets overlooked. That Swiss cheese model absolutely happens where a couple of things had to happen perfectly for this mistake to happen, but it happens. And in those situations, it's just important to own up to it and say that, to both to the, your co-residents and your attendings, and if needed, to the patient, and let them know whatever happened. Oftentimes your attending takes care of that for you. Um, but yeah, I mean, you can do everything perfectly and mistake will still happen. And that's just kind of part of learning. And, for me, it was important to, anytime I made a mistake, even a minor one, I mean, I still make a note of it. I have a
Yeah.
little list of things that I've done to where when it becomes time for me to teach an intern or whoever, a junior resident, I can say, hey, I remember this situation that happened to me, and this is what happened, and this is how you can avoid it. And if you can kind of have that perspective of owning up to your mistakes and trying to learn from them, then even when you do make a mistake, that even if it's not a if it's a bad one, I mean it will happen, but as long as you're learning from it, that's kind of the point. The training that we get is learning on the job. It's not, there's no practice runs for this. You're really just in it, treating people, trying to do the best you can. And so when you do make a mistake, it oftentimes really wears on you, but you have to remember that you're still learning, and you have to have the humility to accept that you made the mistake. And that's really important. So, um, my one of my attendings told me, also, you know, don't be the only person to know bad news. And so he told me that, and I really took that home. In meaning that if you are worried about something, even if it's something dumb, even if it's something minor, let people above you know, and run it up the chain. And it can be the silliest thing, but I have called my chiefs on call. When I've been on call, I've woken them up and said, "Hey, I'm worried about this," and 9 times out of 10, it's nothing to be worried about. And they say, "It's fine, don't worry. We took a look, no big deal." But that 1 out of 10 times, it could even be 99 times out of 100, it's not a big deal. But that one time, you'll be so happy and grateful that you decided to tell somebody about it, because it did right by the patient. It prevented you from making a mistake. Um, and it's an unforgiving field that we're in. Our mistakes, at least in the surgical side of things, but also in the medicine side of things, our mistakes can have significant consequences for patients. So it's important that, anything that you're worried about, work it up the chain, annoy people just a little bit. Everyone knows an intern is still learning. And so most people will respect that you are humble enough and a good enough doctor to be worried about your patient to escalate things.
For sure, for sure. Yeah, I mean, similar, the quote that we usually use and I tell interns or junior residents that work with me is you got to load the boat, right? Even though it might be really freaking annoying, right? I mean, being on the other side of things, right? Me being a chief resident and almost being done. And, yeah, sometimes it is slightly annoying, but at the same time, right? Like, I would rather that happen than any kind of, major thing happen to a patient, right? Because we all care for our patients, right? And so, yeah, I mean, intern year, second year for ENT, same with you, kind of as your junior residents, right? You're still learning, right? And so I would by far, right, have someone annoy me, call me, even like, when you're taking call the first time, I don't mind my co-residents calling me on the weekends, even if I'm not on call. It's just for patient safety, right? And you want to load the boat, right? You never want to make a mistake, and you are the only one holding that mistake, meaning that you've stranded yourself, right? And that's far worse than asking for help. Like you said, 99 out of 100 times it's usually okay, right? Maybe even 999 times out of 1,000 it's usually okay, right? But that one time, right? If that one time, it could be catastrophe, right? And you really want to not be stranded if a catastrophe happens, because worst feeling in the world, right? Like that, you thought you knew something, but you didn't know something, right?
Mm-hmm.
And next thing you know, like everyone around you is like, why did you do this? Why didn't you ask for help? So definitely, for sure, going back to even kind of way at the beginning of this podcast, asking for help is not a sign of weakness. Okay. And that's just something that, we as a field are so bad at it. And ironically speaking, the further along our career, right, the worse it becomes, right? Because like attendings are notorious, like when they're stuck in a bind, they don't want to ask for help, right? And so, for sure, I think asking for help is always a sign of weakness. I mean, a sign of strength. Sorry, always a sign of strength, and it's just better for patient care like that. So,
Absolutely. I think, yeah, it's just, we've talked about this before. You don't know what you don't know.
yeah,
So, like, to ask for help, asking for help is just, a way of double checking against all the things that you don't even know are possible. It can be the most benign presentation that you have seen 100 times as an intern. But that one time that something is slightly different that you didn't pick up on, that becomes a huge problem, right? And so, even if it's, for us, for example, if it's low back pain that seems pretty benign, um, it could be something worse, and it's
sure,
about double checking. It's about calling people for help. And that includes other services. I mentioned calling pharmacy, which is something I've done. I've called radiology and said, "Hey, can you walk me through this scan as to why you're reading it this way and not this way?" And people are always, if you introduce yourself like, "Hey, I'm the resident on this service and I'm just trying to get a better understanding," people are so happy to help you and walk you through things. And you have experts in all these different areas of medicine that, as a doctor, you're supposed to be able to bridge all of these things and kind of be an expert in a lot of ways. But that's what these people that are very good at what they do, that's what they're there for. Asking a respiratory therapist in the ICU, "Why do you guys do this versus that?" So, I don't know any of this stuff. We didn't learn about
sure.
this in medical school. But that's what they do. That's their job. They have a way better understanding of that than you ever will. And so, asking people that really know what they're doing for help, even if it's not a senior resident or an attending or anyone in your field, but just asking other people, what they think is very important. I think that protects you a lot. So I for sure I can do a better job of it. Every resident, every intern can do a better job of it, but it's just something I try to constantly think in my head is like always ask for help.
For sure, for sure. So talk to me about kind of, taking calls an intern. How do you deal with the lack of sleep? How do you know, still function great when, you're working those long hours, you're not having enough sleep?
Yeah, a lot of caffeine, first of all, I think is the big key. Um, I think adrenaline definitely helps get you through things. And then many of my senior residents have told me is you have to like understand where you can be more efficient throughout your day. So this is something really simple, but it really helped me a lot. Is I work in Houston Methodist is a massive hospital. There's a lot of patients are all scattered around throughout the hospital. And so sometimes it's about taking a look at your checklist. I mean, you told me about that app that you use that I use as well as a good checklist. Literally, anytime you have any task to do, just put it down on your phone. It's there. You can always review it. You'll, for sure, if you don't write something down, you will forget it. 100% believe that. You have to write everything down, even if it's the most benign thing to do, because those things can have serious consequences. Um, but going back to what I was saying is, you have to be able to find out where you can be most efficient. So if you have to consent a patient on the 18th floor and also see a consult on the 18th floor, it's probably best to do those things together. Go see the consult, bring the consent with you to go do it. As opposed to going to do it, coming back downstairs, you're going to get paged about something else, going, back and forth, back and forth. Sometimes you just get a feeling and you're going to get paged a lot from the ED. You don't know why it is, but there's just some sort of feeling. So it might be a good idea just to do all your consult notes in the area around the ED. You don't have to go walk back to the resident room and come back. It's finding these little moments and areas of being more efficient that will free up over the course of a call shift, you know, 2 hours of your day. And that sounds like nothing, but when you can get a 2 hour nap in on a call shift when you're pretty tired, that's life changing. That makes all the difference. And so, and then there are going to be lulls throughout the day, and it might be in the middle of the afternoon where, nothing is really going on. Everyone's there on service. Things are flowing really well. You have the APP support to take care of the minor things, and you're just kind of hanging around, like just waiting for things to happen. And it's in those moments that also, whether it's taking a little break and relaxing or catching up on things that you need to do later in the evening. Is it checking up on labs? Is it making sure they're consented? Is it whatever it is? Those are the things that will really help you, because it's those moments that things seem benign, or I can take care of it later, and you don't take care of it, so you don't get consent for this person, or you don't order the pre-op lab for this person, or you didn't realize that their hemoglobin is low and they're going into the OR, things like that. Those things will be what people really get annoyed about, because they're the benign things that you should know to check. And if you don't, then it has serious consequences. Surgery's delayed. Person was an MPO and they had food. That's
Yep.
like something simple, right? It'll happen to every resident that you make that minor mistake. You forget to check the platelets. You forget to make sure they're NPO. You forget to check this lab. You forget to get pre-op clearance, whatever it is. Things happen for sure. But if you write all those things down, then you're less likely for them to happen. So my tips for surviving a call shift are literally to write everything down and then try and find those moments of efficiency that you can kind of lump things together, get them taken care of, and then that allows you to kind of relax and have a little bit of a chiller time. And then lastly, this is just something that I found so helpful. One of my seniors told me this is to go make rounds at shift change. And go to for us, our neurosurgery, we have specific floors for neurosurgery, even though our patients can kind of be all the way anywhere in the hospital. But generally our floor patients that we're actively taking care of are in, one of three floors basically. And so one of my senior residents told me, at shift change, shortly thereafter, go show up on those floors, go find the charge nurse and say, can we run the list together? And is there anything that you guys need right now that I can take care of? Is there anything you can think of? Does someone not have a bowel regimen and needs one? Is someone in a lot of pain and needs some more PRN medication? Does someone have a question about surgery tomorrow that they don't know something about? I'm here on the floor. I can take care of it right now. And if you do that, oftentimes people will find things for you to do. Hey, I need this addressed. But also what it does, when they do have those questions, they feel so much worse about paging you at 3 in the morning saying,
Yeah.
hey, because I know you were here. I'm so sorry, and it just softens that blow a little bit, and they'll try and take care of things for you, right? And so
For sure.
a big lesson is to just be nice to your nurses because they will save you and they'll protect you from things, and they won't page you at 3 in the morning for a bowel regimen because who needs to go to the bathroom at 3 in the morning, right? Like
Sure.
it's not a big
For sure.
deal. They can wait till the morning. So the little things like that, I think, are very helpful.
For sure. Great advice. I mean, since my time here in residency, I've always been super nice to my consulting services, right? My nursing staff, right, et cetera, right, that work with you because, yeah, I mean, um, residency is a long time. Okay. If you piss off a lot of people in the hospital, right, they're going to be annoyed at you for a very long time and they can make your life very miserable, right? Because they are the ones paging you, right? It's not the reverse, right? And so, don't piss people off, right? They're there to help you, right? And you're also there to help them. And the more that you can work with them as a team, right? And everyone kind of works in that team, plays a good role in it, then it makes everyone's life a little bit happier and easier for sure, especially.
Absolutely. I think even like minor things like, if you do a bedside procedure, you're doing an injection or for us, if you're injecting something into an EVD or you're taking out CSF or whatever it is, right? Just clean up after yourself. It's not a hard thing to
100%.
do. But the worst thing is the guy that just shows up and does whatever, doesn't tell the nurse that they're there, just shows up and does their thing and then just leaves a whole bunch of stuff. Like keep
Yep.
people informed, keep the nursing staff informed of, hey, I just did this, or hey, I'm about to do this. And, can you get X, Y, and Z for me? And when they get X, Y, and Z for you, you say thank you so much and you help clean it up afterwards. Even if they're like, no, 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 we got it. It's like, hey, I can throw my sharps away. I know how to do that, or I can
Yep.
clean up after. Those little things make a big difference, and people will see you not as like this, distant, detached doctor who just kind of does what they want, but they see you as part of the team, and they're just
Yep.
way nicer to you afterwards. So,
Yeah. 100%. And that's these are only just, small examples, but it means so much, and so, I mean, you've shadowed me before and I make a huge deal about that, right? When I'm training someone's like, we got to clean up, right? Like, yeah, like we did this huge procedure. We might have taken 2 hours to do it. And, you're usually tired after it, whether it's sewing up a complex slack, whatever it is, right? But, just take that extra 5 minutes, make sure everything's clean, how it was, means such a difference. And of course, like, just how we wouldn't want to come clean up and like maybe there's a sharp missing somewhere in there, right? Like, I mean, that's just like the
absolutely.
worst feeling in the world, right? And so, yeah, for sure, you're gonna know what you use, so you're gonna be like, oh, where's my third needle that I used, right? Like, you're gonna know that, but yeah, such important things because at the end of the day, right, it takes a lot of people to take care of one singular patient, and um, helping out outside of kind of what however we can help out, not just with the procedure, but like you said, saying thank you, right? Things like that are so important. We're all human and we're all taking care of the same patient, so definitely super important. um, but yeah, so switching gears a little bit here. So being yelled at, all right, either by an upper level resident or an attending, right? Tell me how you handle that internally.
Yeah, it's tough when it happens for the first time. I mean, it feels like, the whole world is sort of like, especially when you've been doing fine and been getting good feedback, and then all it takes is, a slip up here, a mistake here. Sometimes it's not even anything you did. It could just be,
Yeah.
you know, things just get directed at you and you had nothing to do with that situation or whatever. And it just, that's what happens. I think realizing oftentimes it's not, most of the time it's not personal, and learning from it and figuring out what to do about it will depend on the type of person you are and how you respond to criticism and stress and that sort of thing. So I think it depends on each person, what to do about it specifically. What I have found helpful anytime that I've gotten in trouble for a mistake that I've made, or even something I didn't do, or kind of put on the hot seat. Is you take it as best you can and kind of listen to what's going on, and then afterwards reflect on it and think about why that situation happened. And sometimes it will be that was completely uncalled for and unfair. But what I've always helped or found helpful, and this kind of goes back to asking for help, is I always reflect on that moment with someone a little bit more advanced than I am. And what typically happens when you do that is they say, like, this is what I would have done differently if I was you, or this is why they were mad about that. Sometimes it's, that attending had a patient 7 years ago who had the same sort of presentation and had a complication, and that's never left their memory. And they're always hyper attuned to that thing. And so you might have thought it was nothing, but for them, it was a really significant situation. Or what will also end up happening, which will make you feel a lot better, is that junior resident, senior resident, chief will be like, oh man, when I was an intern, this is what happened to me. And they'll reflect on the time they got yelled at. And there are these people that seem, at least for, an intern looking up to a senior resident or a chief, for us, 7 years. To us, a PGY6 is like an attending at this point, right? A PGY5 knows everything going on the service, right? For most specialties, you're a PGY5, you're out of the specialty, or you're a chief or whatever. And so for us, we see these people as almost infallible. These guys know exactly what's going on. They're basically attendings. But to hear that person be like, oh man, the same attending yelled at me 5 years ago when I was in your shoes for this. And they were, this is what happened and this is why, it happens to every resident. Every resident makes a mistake. Every resident has been yelled at fairly, unfairly. And so just kind of sharing in that situation and that experience for me has been helpful. And then you get really good advice on how to prevent it from happening again. Here's what you can do differently, stuff like that. And so again, it goes back to asking for help. I think ask for help or share, tell people like, hey, this is what happened. I'm not exactly sure what I went wrong. What do you think? I think all that is very beneficial. And still to this day, I mean, I text you all the time about like, hey, this happened in the hospital. I mean, even across specialties, across residencies, across hospitals, it's like we all kind of share in this misery as residents together, where it's kind of the same thing over and over again. So it's important to talk to people you trust who've been through it before and then give you good perspective.
For sure, 100%. And being in kind of that, the little compare contrast here is I'm on the other side of it now, right? I'm the fifth year, right? I'm the chief, kind of about to finish, right? And exactly, kind of our new interns exactly in your position, right? And kind of saying, oh, me being that person, telling them exactly what your experience is. I would tell them exactly the same thing. Hey, I've gotten yelled at this when I was in your shoes, right? But one of the key things that, from my perspective now is exactly kind of what you're saying is I'm trying to give advice on like, what can you do better, right? What can you improve on, right? How do you prevent this from happening? And then also at the same time, being that person, being like, yeah, I can relate to that, right? We've all been yelled at, right? Certain situations here, right? And so that, it's not just, sometimes it feels like, oh, it's just you, right? It's like, oh, you're the only one that's ever been yelled for at this particular moment in time for this situation. Usually, even though it feels like that at the time and you feel really shitty about it, right? And, you feel like you said, maybe the world, like, because these people that are yelling at you, these are the people that you're trying to emulate, trying to impress, trying to, be one day, right? And so it does not feel great, but also know that you're not the first, you're not the last, right? That's going to be yelled at this particular situation, even though at that time it does feel like that. But yeah, I mean, for the past 5 years, it's not like it stops, right? It's going to continue to happen. And so, yeah, asking for help, asking advice for people that's been through it already. Like you said, your fifth, sixth, and seventh years, if you're in neurosurgery, your chiefs in, if you're in family med, if you're in peds, your third years, right? Or surgical subspecialties, your fourth or fifth years, right? Because yeah, we've all been through it. And at the end of the day, it's trying to reflect, trying to be better, trying to improve, trying to not take it personally. And some of the lessons are, even if it's unfair, it's, oh man, maybe I just need thicker skin, right? As you kind of already know, right? Sometimes there's nothing you could have done better, right? And it's just, you just happen to be in the vicinity of someone pissed, right? And yeah, it's unfair, but sometimes the best lesson from that is, I always say is, one, that's someone you don't want to be and don't want to emulate. Two, and you want to get thick skin, right? That's kind of, sometimes that's all that you can learn from it. And it doesn't happen very often, but when it does, it doesn't feel great, but you just kind of have to move on from it because 7 years is a long time.
Yeah, and sometimes, I mean, it is unfair, but life is often unfair. And sometimes, it's just what happens. And I think most people will see that situation and be like, yeah, that was just, you just got caught in the wrong place at the wrong time,
Yep.
Um, And truly important to remember, which one of my chiefs had told me too, is like, the person that's getting mad, whoever attending is disappointed in you or is getting upset with you, they also at some point in their career got yelled at,
Yep.
for something, right? So
Yep.
it's just a thing that happens, and again, it's trying not to take it personally. It's different if it's, it hasn't happened to me. I'm very fortunate. My program is not a malignant one, and no one has that personality.
Sure.
I think it is different when it is a little bit malignant. I don't have great advice on how to deal with that, but nonetheless, I think a lot of those principles still apply of asking for help and reflecting on what you could have done better. And I think people will respect a person who has some thick skin, who is committed to doing better and owns up to when they make a mistake. And if you do those things and you can be humble and continue to work hard and not let it affect you, it will affect you, but not let it affect you as much as it could. People will respect that and give you more leeway in the future. So
For sure. 100%. 100%. So let's talk a little bit more about more fun things here. We've talked about more serious things about, intern year, but talk to me, you're a great basketball player. You've shown it multiple times as we've played and kicked my ass. You also play soccer. How do you find time to play sports or work out during residency?
working out has been very, very difficult. I think
Yeah.
it's something, what I've been told too is, don't try to do everything all at once. So intern year, a lot of it, especially early on, you're gonna have to sacrifice a lot of those things that were important to you, just so that you get a little bit comfortable about, getting comfortable with the flow of your service is just, it takes time. Never mind the material and the patience and, you know, technique and all of that. Is just, how does the service work? Who do I do this for? How do I escalate this, et cetera, et cetera. So giving yourself some time to just adjust is very reasonable. And then slowly, which I've started to do a little bit more of now, is like implementing things that make you feel a little bit more human. So, I've joined a soccer league with some of my friends. We play, once a week, and it's somewhat of a low commitment. It's an hour, hour and a half on a weeknight. Sometimes I can't make it if I'm on call or pre-call and it's too late. But it just, something that makes you feel, a little bit more of like a human or kind of pursuing interests that you had outside of medicine. I think my advice, what I've been trying to do, is sort of slowly integrate those things in as you become more and more comfortable with the material, with the patient, with your responsibilities, with the service, what's expected from you. Then you can start adding those things in. And so you'll find that a lot of, like, I know a lot of my senior residents seemingly look like they have it all figured out. They're able to, exercise, they have, spend time with their families well, they're amazing on service, they know every answer to every question, they're fantastic in the OR. And if you talk to those people, they'll say that's not something that just like happened, right? That takes time and, really diligent focus on trying to add those things in. And so that's what I've been trying to do. I would like to, obviously have way more fun outside of the hospital, but I'm lucky that our schedules are pretty reasonable for surgical residents, and so we do have a good amount of time outside the hospital. And so I'm trying to work in studying and my own interest into those things. But yeah, you got to be patient. Take your time with
Yeah.
it.
Yeah. Yeah. It's just like any other skill. It does take some time. I can tell you that, took time to get efficient. Efficiency is so key, right? Like I said, you gotta master your craft at work, and whether that's studying your technique, rounding, all those things, right? It should get better and better over time. And as you get more efficient, as you kind of see the same kind of patient, motif, or kind of the same patient category, right? Like every VP shunt is done, XYZ, right? Every time that you work through a VP shunt patient is XYZ, right? Once you have kind of those in your mind, right? Patient templates is usually what I call them, right? Then you just become very more efficient, right? You're not having to look up, let's say it's taking you 3 hours to pre-round because you have to look up every detail because you don't know, right? But that should, over time, I mean, by the time you become, you're starting to get upper levels, those things usually start taking only 5 to 10 minutes because you practically know it like the back of your hand, right? Yeah, so you're going to free up more time, but it does take time. It's not an overnight thing for sure.
Absolutely. I think that, pre-rounding is a great example where the amount of time it takes me to pre-round versus our fours is just, they take half the time, if not less than half the time.
Yeah,
because they just know exactly what they're looking for when they have a post-op patient on with this or someone on the floor with this. It's and they already know, whereas I'm sitting back and reading through notes about this, this, and this. It's like they've already picked up on those things just throughout the day, reading up on people or knowing the list really well or picking up on things in rounds that are discussed or talking to attendings and knowing, you know. So it takes time and it's important to just keep, try and do things the right way. So for me, it's still showing, even if I would rather show up early to pre-round and have a whole bunch of time before round start versus the opposite of being
Yeah.
rushed and forgetting things. And so it's about building those good habits in. And so when you do learn and you do figure things out, you just have way more, a way better understanding of what's going on, and you can kind of fit in all those things that we talked about into your life again. So
Sure, sure. And, I know we're running out of time here, but I have only a couple questions left. So talk to me a little bit how you balance work with marriage. I guess, since you are a married man, it must be difficult since you are an intern in a surgical subspecialty.
yeah, it's been a massive, massive challenge in trying to find a good balance between work and trying to spend time with because I've only really been married. I've been married for a little bit more than a year now. So most of my intern year, yeah, or my time in residency has been my time in marriage essentially. And so, it's about being sort of deliberate and really intentional with the time that you spend with, your spouse and, in medicine and communicating very effectively. So I'll tell my wife, hey, today's looking like it's going to be a long day. I'm probably not going to make dinner today. Or, when I get home, I need to do X, Y, and Z. And I'm lucky that I have a very supportive spouse who is also very, very busy with her career. So it kind of helps in that sense, but I'm not perfect at all. I'm still figuring things out. It is very much a challenge. The best piece of advice I could give is just communicate
Yeah.
very openly about what you need to be doing, and what your responsibility, and even communicating with your own, program. I mean, I've talked to, I let my residents, like my co-residents know, like, oh, I'm going to celebrate my anniversary with my wife or excuse me, something like that, right? And it
Yeah.
helps people, we can soften the blow of whatever
Yeah.
you're dealing with a little bit. We'll take, why don't you go home a little bit early and we'll take care of this or whatever, right?
Yeah. Yeah.
Stuff like that. I have a doctor's appointment for somebody in my family. Like, is it okay if I, go take care of this real quick? People are your co-residents are, as long as you're not abusing it, are very willing to help. And
Yeah.
so I think openly communicating both with, my wife and then also my program has been very helpful. So.
Yeah, for sure. For sure. I mean, question since we're on the topic of communication here. I mean, do you feel like one of the most difficult things in residency is actually the communication aspect of things? I feel as though, like you said, that's just only one aspect of communication, right? You're talking about communicating with your co-residents, your attendings, right? Your spouse, right? But, I always say, and I think I've told you this before, some of the hardest things in residency has nothing to do with actually the medicine itself, but, interacting with people, right? Communicating with them on a good level so that, information's passed on appropriately and everyone's on the same page. What is your opinion on kind of communication?
Absolutely. I think, so much of your success as a resident can be dialed down to how well you communicate. If you're talking to patients and they think you have great bedside manner, that will for sure get worked up to your attending, and they'll say, hey, your resident, Dr. So-and-so, was like fantastic and kept me up to date on your plans, constantly checked on me, talked to my family, I've called family members on my drive home and filled them in on, hey, we didn't catch you in the hospital today during rounds, but your mom wanted me to let you know this is what we're thinking,
Yeah.
this is our plan, right? Talking to consulting physicians, right? It's so easy as being on the consultant side of, you get the page, you do the workup, you drop your consult note, and then it kind of gets lost in the ether. We'll figure things out when we get the imaging or blah, blah, blah. But even as simple as, shooting them a message, if you're, whatever EMR you use, shooting them a message and saying, hey, this is like what we're waiting on. This is what we think. Dropping a note, a really quick progress note of this is what we're waiting on. This is what we're looking for. giving them a call. So you'll end up having everyone on your phone eventually. And as a resident, you'll find all the attendings, all the
Yeah,
different residents' phone numbers, shooting them a text. Hey, that patient that you consulted us on, this is what we're waiting on. I think it goes a long, long way. It prevents you from getting paged later. It prevents patients from being unhappy with that, not knowing what's going on. And it keeps just everyone informed. And I think that if you can figure that out quickly, um, that's great. And I think that also protects you from some mistakes that you make too, right?
yeah,
So
for sure,
yeah.
for sure, for sure. Yeah, I mean, having a lot of people have your back, whether it's patients, whether it's your co-residents, whether it's consulting services, whether it's your attending. I mean, communication is so important, and sometimes it is a little bit more difficult because you're trying to figure out, oh, one person, communicates like this, right? And sometimes it's just kind of like, oh wait, like that's not, what I said, and what they got was totally different. And
Mhm.
sometimes it just deals with tone, sometimes it deals with timing, like communication. So sometimes it's so difficult when you're dealing with so many people, but yeah, it's so important, especially in medicine. So for sure.
Yeah, especially when you're swamped on call and something changes and you just forget to tell a patient. It happened to me where you know, we started a patient on a heparin drip, and the patient didn't understand why, and it was something that happened to me on a call shift where I was getting slammed with a number of pages, and actually, you know, we were the consulting service, but the primary team started on heparin drip, and it was fine, and everything was okay, but the patient didn't know, and um, my attending was like, it's important for you, why, right? It doesn't matter who put the order in, it doesn't matter who's managing it. Like, if you know why, go talk to the patient or give
Mhm.
them a call. Like, it's not hard. Um, even if again, it goes back to writing things down. It goes back to, being an effective communicator and taking ownership of your patients, even if you're not, the person that put in the order. If you know why something's happening, go talk to your patient about it. They'll respect you for being the one to go talk to them. You know, especially on the floor, patients just love to see, they see their doctor for, we round on them at like 4 in the morning, and our attendings will pop in between cases or something and talk to them. But beyond that, I mean, they don't really see doctors that much, right? People come
Yep,
talk to them for a few minutes at a time and then go off and do something else. So if you can give them a call in the room, show up at their door and just say, "Hey, I just wanted to pop in and tell you what's going on," they respect that so much. So
for sure. 100% for sure. Well, I got only one last question here. I know, we went a little over, but you had so many good things to say. So I figured, we'd extend this a little bit. But well, my last question to you, what advice do you have for medical students trying to match into neurosurgery? If you were to, sum it up into kind of, a big overarching piece of advice.
the number one, and it's something I wish I did earlier, all of your success can be I think, boiled down to this, is find a mentor or mentors who, like we talked about, career you want to emulate or at a place where you want to be, and latch yourself onto them. And, they may say no at first, or, you may have to find somebody else, but most people are very willing to help. And if you can find that person who you admire and look up to and is where you want to be, and just pick their brain about everything. And don't be afraid to ask for help. Don't be afraid to hear no as an answer. And just, find a mentor and continue to work hard. And chances are you'll get close to where you want to be.
Great advice. Great, great, great advice. Yeah. Yeah. I always say, it's kind of like that you're teetering on a line of when asking for help. It's kind of like you're always thinking, am I annoying or am I not? Right. But, you got to kind of, like you said, if you have no, then try again another day sometimes. Right. Because, a lot of the times it's very situational. Most attendings, right. Are willing to help. Just maybe the timing wasn't right at that moment in time, but try again, right? And having that mentor is so important. That's how I got into ENT, and it seems like that's how you got into neurosurgery. And so definitely, for sure, definitely, great advice. Well, I appreciate you kind of making the time today to be on the podcast. I'm sorry we got a little bit over time, but I hope we get a chance to do this again.
Yeah, absolutely, man. It was fun.
Yeah,
Always good to chat.
yeah, for sure. Well, I'll catch you later, but thank you again for joining me on Beyond Scrubs. And so, Dr. Ismail here.
Thanks.
Yep,
See you
later.
later.